There are little things you do every day, like brushing your teeth, drinking water, or even smiling that seem too ordinary to matter. But believe it or not, these small habits could actually help save your heart. Done right, these simple routines can quietly and effectively prevent a heart attack without you even realizing it. No need for expensive prescriptions. No need for major lifestyle changes. Older adults in the U.S. can absolutely prevent a heart attack through simple actions in daily life. From how you brush your teeth each morning, the timing of your water intake, the way you laugh to the air you breathe. All of these can help protect your heart from the risk of a heart attack. This article will share 5 drug-free strategies to prevent heart attacks recognized by leading medical organizations, especially suited for seniors who want to maintain stable heart health, live longer, and avoid worrying about dangerous complications. Gum disease, the silent trigger of heart attacks. Few people know about it. Might sound unrelated at first, but your teeth and your heart are more connected than you think. As a physician, I've seen numerous patients who suffered a heart attack, and the root cause actually started in their mouths, where billions of bacteria thrive every day. When you have gum disease, especially severe forms like periodontitis, the infected pockets around your teeth can allow bacteria from the mouth to enter the bloodstream. These bacteria can quietly trigger inflammation. Damage blood vessel walls, increase the risk of blood clots, and ultimately lead to a heart attack or even cardiac arrest. A study presented at the European Society of Cardiology ESC Congress 2021, led by Dr. Giulia Ferranini from the Karolinska Institute in Sweden, revealed a striking connection. People with gum disease have a 49% higher risk of cardiovascular events compared to those with healthy gums, especially individuals with a history of minor heart attacks. What's more concerning is that heart attack symptoms in women are often much less obvious than in men. Instead of sudden chest pain, many women experience vague signs like persistent fatigue, mild nausea, or even sleeplessness. These subtle symptoms are easy to ignore until it's too late. So how can you protect yourself? Start with the basics. Brush your teeth correctly twice a day and get a professional cleaning every 6 months. Don't skip flossing and make sure to schedule regular dental checkups. These small habits could save your heart. Remember, keeping your teeth clean isn't just about having a nice smile, it's about staying alive. Because sometimes the quiet guardian of your heart is your toothbrush. Drinking water at the right time. A habit that seems small but could be the key to preventing heart failure. As a doctor, I often remind older patients that the heart doesn't just need medication. It also needs daily nourishment through simple actions like staying hydrated. When you don't drink enough water, your blood becomes thicker. Circulation slows down, and the heart has to work harder to maintain blood pressure and deliver blood throughout the body. Over time, this can weaken the heart muscle and lead to congestive heart failure, a chronic condition where the heart can no longer pump blood effectively. A major study by the National Institutes of Health (NIH), published in the European Heart Journal, tracked over 11,000 middle-aged people for 25 years. They found that those with higher serum sodium levels above 142 MEq or L, a sign of chronic dehydration, had a 54% higher risk of developing heart failure than those who stayed well hydrated. Even within the normal sodium range, each unit increase raised the risk of cardiovascular disease by 5%. Heart failure symptoms, like fatigue, shortness of breath, and leg swelling, often appear quietly in older adults, but are easily dismissed as just signs of aging. In fact, prolonged dehydration is one of the most underrated risk factors. Staying hydrated not only keeps blood flowing smoothly, but also reduces the heart's workload and lowers the risk of blood clots, which can cause heart attack and stroke. So don't wait until you're thirsty to drink. Start your morning with a warm glass of water. End the day with another before bed, and aim for 6 to 8 glasses daily. A single glass of water might not cure illness, but if you drink it the right way and at the right time, it can absolutely help protect your heart from serious complications later on. Laughing every day, not just joyful, but a natural vasodilator for your heart. Laughing every day isn't just about joy, it's actually a natural vasodilator for the heart. Throughout my years of practice, one thing has become clear. Patients who stay optimistic and laugh often tend to recover faster after cardiovascular events. They're less likely to experience recurring heart attacks, need fewer sedatives, and most importantly, feel less lonely. A psychological factor that can quickly weaken the heart in older adults. When you laugh, your body releases endorphins, feel-good hormones that naturally relieve pain and help blood vessels relax. This process increases blood flow, lowers blood pressure, stabilizes heart rate, and reduces the chance of blood clots, which are a common cause of sudden heart attack symptoms. Laughter also reduces cortisol levels, the stress hormone linked to increased risks of heart failure and stroke in seniors. A study by the University of Maryland School of Medicine conducted an interesting experiment. Participants were divided into 2 groups, one that laughed often and another that was more serious and rarely laughed. The results showed that the laughing group had 40% better blood vessel dilation, significantly lowering their risk of heart disease. Researchers concluded, laughter produces physiological effects similar to light exercise. So if you're looking to prevent a heart attack without daily medication, start with something simple. Spend 15 minutes a day laughing. Whether it's a favorite comedy show, a phone call with a loved one, or simply jotting down 3 things you're grateful for today. A well-timed laugh might just work better than a prescription. Air pollution. The silent culprit behind heart attacks that few people recognize. When it comes to the causes of a heart attack, people often think of high cholesterol, blood pressure, or lifestyle. But there's another dangerous factor that's just as serious yet often overlooked: air pollution. As a doctor, I've seen many patients whose heart attack symptoms in men or heart attack in women symptoms worsened after living for years in polluted areas near highways or factories. And this isn't a coincidence. According to the U.S. Environmental Protection Agency, EPA, PM 2.5. Fine particles about 1/30th. The width of a human hair can penetrate deep into the lungs, enter the bloodstream, cause vascular inflammation, and increase the risk of heart attack and stroke. A study from the EPA showed that just a few hours of exposure to high PM 2.5 levels is enough to trigger serious cardiovascular events like arrhythmia, chest pain, or even cardiac arrest versus heart attack in individuals with underlying heart conditions. For older adults or those with diabetes or high cholesterol, the risk is even higher. In particular, signs of a heart attack in women caused by air pollution are often subtle fatigue, shortness of breath, or mild chest discomfort. These signs are easy to dismiss until complications arise. If you live near busy roads, parking lots, industrial zones, or areas frequently affected by smoke from wildfires, be especially cautious. Poor air quality doesn't just damage your lungs, it silently weakens your heart over time. And the danger is PM 2.5 can quietly drift indoors, linger for weeks, and affect you even while you sleep. Check the AQI index daily, use air purifiers, and avoid going out during rush hours. That's a simple way to prevent a heart attack and keep your heart healthy even while living in the city. In addition, I advise my patients to grow more greenery around their home's plants, like peace lilies, snake plants, or aloe vera, which NASA has proven to help filter toxic air, and if possible, switch from wood or coal stoves to electric or clean gas stoves, especially during winter. This isn't just about protecting your lungs, it's about protecting your heart every single day. Hidden salt in your meals. The silent culprit behind heart attacks you never saw coming. When it comes to the causes of a heart attack, most people think of high cholesterol, high blood pressure, or smoking. But there's a hidden danger present in our daily meals, more subtle, more common, and harder to notice: hidden salt. This isn't the kind of salt you add with a spoon while cooking. Hidden salt lies deep in processed foods like sauces, snacks, deli meats, frozen meals, and even bread. Consuming too much sodium quietly raises blood pressure, damages blood vessel linings, and forces the heart to work harder. According to the American Heart Association, Americans consume over 400 milligrams of sodium per day on average, nearly double the recommended amount. Meanwhile, simply cutting that down to under 500 milliliters per day can reduce the risk of stroke and heart attack in older adults by up to 25%. As a doctor, I've seen many elderly patients with typical heart attack symptoms in men, like chest pain, shortness of breath, and cold sweats, and when we trace it back, high blood pressure caused by salty diets is often the leading cause. In women, heart attack symptoms in women are even harder to recognize, just fatigue, nausea, or mild chest pressure. But the consequences are no less severe. So how do you prevent a heart attack right from the dining table? The answer lies in small but incredibly effective actions. Start by reading nutrition labels carefully. If sodium exceeds 300 milliliters per serving, cut back. Prioritize home-cooked meals using natural flavorings like pepper, lemon, and ginger instead of bouillon or soy sauce. Avoid fast food, even if it says low fat, because the salt content is still high. And especially if you have high blood pressure, stay away from fish sauce and processed foods, because it's hidden salt that slowly weakens your heart every day without you even realizing it. Heart attack versus stroke can begin with small things like salt. And sometimes what kills your heart isn't one dramatic event, but the salty habits you've built up over time without knowing. Remember, a heart attack doesn't always start with intense chest pain. Sometimes it begins with the quiet eating habits you repeat every day. Cutting back on hidden salt, reading food labels, and cooking at home not only help control blood pressure, but also serve as simple yet powerful ways to protect your heart. Don't wait for a crisis to make a change. If you found this information helpful, feel free to leave a comment below. I'd love to hear your thoughts and walk with you on this journey toward a healthier life, one day at a time.